It's lovely to be back in Cork. I have a great fondness for Cork because that's where I did my nursing. So that's where I learned to party, socialise. My Cork friends taught me everything I know about growing up when I was 18 to about 23 or 4. So I have very fond memories of it. And I also had the pleasure of working with the Health Promotion Department in Cork for a number of years. So it's a pleasure to come back. So I suppose just moving on, in terms of what I'm going to cover today. So I'm just going to talk about the journey in terms of developing the healthy workplace framework, and what we've learned along the way, the key milestones we've had and the challenges, because our work in health promotion is always challenging. This end of the system never gets the same focus as the services. As I said, nobody goes out and strike because they don't get health promotion work. So there's always challenges along the way. And it is interesting now that we are developing a national mental health promotion plan as well, the first one ever in Ireland. So there is a good synergy in terms of the work, and how much of that needs to be cross-government, that health alone cannot address the challenges that face us. So just to remind ourselves, I suppose, at the outset, in terms of what influences employee health and well-being, and every one of us in this room are probably an employee. Some of us might be managers, so we're all, this applies to ourselves as well. So in terms of what influences it is, our individual characteristics, our personal health choices, our beliefs, attitudes and values, that they're core to all of us and they hugely influence our well-being. But then the workplace characteristics, including, and Jane has referred to some of these, our job design, the workplace culture, management styles, physical work environment and terms and conditions. So it's important to be able to see the distinction, because my experience, a lot of the interventions in terms of workplace tend to be up in the first half around personal health choices, that's where a lot of organisations start. And probably because there's a lot of focus on it as well, politically and in the system, that we need to address these issues that are causing morbidity and mortality. But just to be mindful that all the other factors have a huge impact as well. So in terms of the developmental process, which started a number of years ago, got shut down rapidly overnight when COVID hit the scenes, but then post-COVID, there was a huge demand for workplace well-being. It literally moved it up the agenda. And I think mental health as well, the whole area of mental health and well-being, it came up the agenda at an enormous rate post-COVID. So we took the steps in terms of good practice for developing a workplace framework. We had the consultation, we had research into the benefits and the cost-benefit analysis of workplace interventions. We looked at capacity building, which was an interesting one at the time because there was no training whatsoever on workplace wellbeing in Ireland. And now it's great to say we have the postgrad in Galway, we've got a postgrad in Trinity, and we've got the AMA in Limerick. So it's great to see that, because that piece I think is really important, building capacity, that people have the skill set when they go back to their workplace, whether they're in HR, whether they're in health and safety, whether they're in health promotion, or a dedicated lead. The capacity piece is really important. We also, the HRB did a really interesting piece of work for us, looking at the different tools and resources in 5 countries, which is on the website. And we also did some work on looking at what an accreditation model would look like for Ireland. We haven't published that because it sets up expectations and we just don't have the resources. And we also went out to organisations to see what they were doing and how they were doing it. And our case studies were very helpful as well, in terms of the experience of workplaces and what they learned along the way in their journey. So that was all the groundwork, I suppose. What we learned along the way, and I mean, this was backed up internationally, but as Jane mentioned, we have very little data in Ireland. There's a huge gap in data in terms of workplace, in terms of evaluation. There's so much work that we need to do to bring ourselves up to our international colleagues. But workplace was recognised as definitely a setting for health promotion, and that's backed up by the international literature. The evidence to support effectiveness is growing all the time. There's more and more evidence and more research. But again, we need our own research here. And that's why it's so great to see the work that Jane and her colleagues are doing in Cork, because we need more localised research that people can relate to. They need to integrate health and wellbeing into workplace values, and that's so important because organizations are great for mission statements and spending days and weeks kind of defining them, but actually implementing them and following them through can often be the challenge. So it needs to be core part of it. The critical role of leadership, it came up over and over again, how important it is to have leadership, have someone with a vision, have someone with the mandate of the whole workplace wellbeing agenda. And the importance role of workplace culture, of all the areas that kept emerging through consultation, through research, all the reports we did, culture came out top in terms of how it impacts on well-being. And partnership working is so important. So I would say in organizations, whether it's HR or health and safety or occupational health, it's about them working together. They all have a role. Whoever's responsible, doesn't really matter if people are working together and they can have a common vision and a common goal. So this is the framework, and I brought some copies there. I left them in the back of the room. We finally got it over the line almost 2 years ago. And actually, in hindsight, I was really glad we hadn't published it before COVID, because we had to change it. We had to bring in remote working. It would have definitely stayed on a shelf and gathered dust if it had been launched in early 20 or previously. So timing was good from that point of view, because we had a more accurate picture of work life in Ireland when we published the framework. And suppose what the framework does, and like I remember many years ago working in health promotion thinking, oh, what do we need policies for and what do we need strategies for? But I've learned if we don't have a policy or a strategy, we don't have a mandate. And I think the same applies to the workplace. Unless you've some strategic policy around health and well-being, which includes mental well-being and includes this type of psyched initiatives, it's really hard to gain traction. So the strategic vision is really important. And it sets it out, I suppose. And I remember when the first health promotion strategy came out, actually in 1985, and I remember feeling, oh my God, this is great. I now have a mandate. I can now go to my leaders and say, this is important. This is a Department of Health initiative. We have to support it. So that piece is really important. So I suppose the whole underlying theme of our Healthy Workplace framework, it's very much based on health promotion principles. It's very much based on the WHO model of what works in workplace wellbeing. So it embraces all of those kind of principles. So it's all about supporting the growth of effective approaches to health and well-being in the workplace. And I suppose what success would look like is that the health of Ireland's workers is improved. Changes in culture, policies and practices in workplaces lead to improvements, physical, mental health and well-being and work-life balance. So that's quite aspirational, but that's ultimately our aim and what we would love to see happening in workplaces. The principles to guide implementation, I think these principles are really important. So the sustainable culture change is up there first. Safety first. So there's no point in talking about well-being in a workplace if the basic safety agenda is not addressed. So we would always say safety first. But the safety piece gets real priority in workplaces because it's legislated for. And anything that can be monitored and anything that can be that has to be reported on will get measured. And it's difficult to get health on the same and well-being on the same agenda. Some organizations are really positive in that, but because there isn't, it's voluntary, and obviously it's ethically, it's morally, it's all of those things, but still at the end of the day, it's voluntary and getting the commitment around it. But so I suppose ultimately what I would like to see is that the health agenda would be embedded in the culture like the safety is. People don't think about safety agenda anymore. I do remember the first health and safety inspection we had in health promotion, and it was like so stressful because we had never there was nothing about health and safety when I started in it, and then suddenly it came on the agenda. But now that has just become the norm. It's embedded. Nobody thinks, when people go in to work and they say follow these safety guidelines, construction sites, they all have to do. They have to have their safe pass. So it's really embedded. But we have a long way to go to get the health piece in that. We also, as one of our principles, is that there's no health without mental health. And it's bringing mental health back into that holistic model. Because I would very much have felt over the years that mental health was nearly out there and physical health was here. And that the whole person that we talk about, and the whole person model of health, is that they're very much integrated. My physical health affects my mental health, and my mental health affects my physical health. They're so intertwined in terms of separating them out. The importance of engaging and empowering employees. Like engagement can be at many different levels in organizations. But the critical piece of people feeling engaged, feeling listened to, asking what's important, that's crucial. And it's a principle of health promotion as well, that we don't assume what people need. We ask them what they need. That's one of our underlying principles. And then empowering people, supporting people to make choices, supporting people to make changes if they want to, and giving them whatever support we can. Integrated ways of working, again, so it's not one size fits all. Every organization is different. Their age profile, males, females, the needs can be very different. Proportionate universalism, and again, looking at the needs of the workers that are least supported. And very often these are the low-income workers, and they're often the ones with the greatest need. A bit like our communities, that the areas of deprivation are the communities with the greatest need. And ultimately that is evidence-led. Whatever we do is evidence-led. So the objectives, they're very much, I would see these objectives applicable to any workplace if you're starting off to develop that strategic vision. So it's about having implementation structures. So we have established a national implementation group in the Department of Health. And so we are still, and I'll talk a little bit more about that in a minute, but the implementation piece is challenging because there isn't a group of health promotion people who work specifically in workplaces. There are people in the HSE who work on staff health and wellbeing, but we don't have individual staff who support external organisations. We did have a number of years ago, and they all got lost during the recession. But so we don't have if there's a physical activity strategy launched, there's a pathway, because there's local sports partnerships, there's physical activity coordinators on the ground. We don't have that seamless flow of people in terms of workplace. So the implementation still it's challenging. The raising awareness in terms of building communication plans, meeting groups, telling them about what's going on, all of those are important. Driving engagement, as I mentioned, transforming culture and looking at what is the culture within an organization and how do we measure the culture? How do we pick up what's going on? Providing supports for our workplaces, and we did launch our website, which I'll talk to you about in a minute. Sharing good practice. So I have found over the years that, and today's evidence of it as well, that when we put on an initiative around workplace wellbeing, there is great interest. There's a lot of people who are really keen to learn more about it. And it's also, I think, because very often in a workplace, there might be one individual pushing the agenda and they can feel quite isolated. So coming together and sharing ideas and learning from each other is really valuable, and something that we try to have an event once a year to facilitate that. And then to drive quality improvement. We need to continuously be looking at how we can improve on what we deliver on. So what emerged as well from the process was around what workplaces needed. So training actually came out top. So the training and to have the confidence to deliver workplace and to address the challenges. Guidance documents, case studies, and we have on our website a series of case studies. Learning networks for the sharing of practice. Regulation came up quite strongly, and I know there was in I think it was 2015 or 16 there was a movement by the then Minister for Health, Leo Varadkar, that he was going to bring in legislation to support wellbeing in the workplace, in public sector, but it got lost in the post-COVID. But I think it is important. It is ultimately part of the Health and Safety and Welfare at Work Act, but it's kind of to bring it up a level. Some fiscal incentives, and some of those have, there's some grants available, I think, for workplaces through Deeper in terms of putting in facilities and that. And then accreditation and benchmarking awards was really important to workplaces. And I've learned that over the years, workplaces love to get recognised and acknowledged. And I think that's probably one of the reasons the psyched journey here as well is that it is really well supported and acknowledged, because there's a recognition that workplaces are stepping up to it. So straight after the launch of the framework, the first thing we did was we commissioned an options appraisal, really to look at, like, we have kind of over 2 million people in work in Ireland. We have endless workplaces. We have private, public. We have large, medium, small. Where do we start? So basically, Grant Thornton did this piece of work for us, looking at through desktop research, international benchmarking and consultation with key stakeholders. And the findings that emerged out of that was that we should take a phased approach and build this up. So the idea of a phased approach is that we recruit a number of organisations and we work with them through the stages of becoming a healthy workplace. And then there's an evaluation built in and an action learning. So, and then for the second phase, you build on that and you take the learnings from the first phase. Because we really need to develop our evaluation tools from the Irish perspective. Essential as well as part of that was that we have a robust communication plan, engagement with the stakeholders, partnership working, and then consideration for SMEs. So that was what they came up with based on looking at other countries and what they're doing. Just to say, like, our colleagues in Wales, Scotland have dedicated national workplace wellbeing units with a significant budget. You know, they are way ahead of where we are. New Zealand, Canada, England is slightly different, but in those other countries, they have a very structured system. And Wales would be about on par with our population size, and they have a very significant budget to drive this agenda, completely funded by government. So we have a long way to go. Coming out of the consultation and all that, the culture change, as I said, came up very strongly. So the HRB did a piece of work for us looking at promoting workplace health through culture change and what are the factors that contributed. And I suppose what they came up with, and that report is on their website as well, is that health and wellbeing interventions are mediated by workplace culture change. So there's a strong correlation there from their research. And that the cultural drivers include job control, information flow, job demands, organisational support, line managers' attitudes and actions, and leadership and feedback. So all of those factors influence the culture in a workplace. And I know, you know, the role of the line manager, it's emerging more and more, I think, in the research around what an influential role they have in terms of the employees they manage. And I think every one of us can reflect on, there are times when I was really well managed and I thrived, and if there was times when I wasn't well managed, I went the other way. So poor line management can have a negative impact on us, and it can also support us. And I was reading there that the last CIPD report talks about that the relationship with the line manager is the biggest source of stress in workplaces. It's the one that keeps us awake at night. It's the one that is, as I said, they're under my pillow sometimes. And then when you have the opposite experience, it's like, it's so fulfilling and it's so nourishing, you know. So it's a huge area and something I feel really strongly about that we need a lot more focus on, and I think line managers need support as well. You know, I'm not saying, but in terms of how they're trained, it's very much can be a very limited model and not really often reflecting on their own personal growth and their own personal values and that. So it is really I think it's a critical one in this whole field. I mean, you can have great leadership in the top, but if you haven't got the middle piece on the jigsaw, you're not going to finish it, you know. So it is really important. The other piece then, just to say where we're at the moment and what we're doing. So we commissioned the first national survey on workplace wellbeing. So that was tendered for last year, and that has just been started, and that is basically to give us some baseline data, because we don't have any baseline data in Ireland around workplace wellbeing. So that'll take a population sample and one in a telephone interviews as well, in terms of looking at their wellbeing, looking at their workplace, their culture, their experience of management, all of that. So it's quite robust, and so that is great, because the idea is that this will give us a baseline, and then it may be repeated in 2 years or 3 years or whatever. So it is important to have our own data, and especially when you're making a case in your own country, it's really important that you have your own data, that we're not talking about data from UK or America. It has no relevance to when you're making that business case. So having that data, we felt, was really important. We provided some seed funding for the local authorities because they launched their own framework for workplace wellbeing about 2 years ago, and they had come to us looking for some support. And we have a very strong relationship from Healthy Ireland with the local authorities. They deliver and drive out a lot of the projects that we that are funded by Healthy Ireland. So we give them some seed funding to help them get going. And again, a very challenging areas, because in local authorities you have remote working, you have people then who work outdoors, you have people in offices. Like within any given area, there's a huge diversity of workers, so the needs can be very different. We launched the that should be launched at the Healthy Workplace website. Sorry, we launched the Healthy Workplace website last year, and I'll just show you a clip to that in a second. So that was a really important piece for us at the outset. With limited resources, we said, what can we do? We can do a website that's kind of one-stop shop for workplaces in terms of where do I begin, how do I start, who do I need to engage, what are the resources and tools that I need. And so we have started that. It was launched, and there's a lot more work to be done on it. But I'm after clicking back. So it's a good resource, I think, in terms of we've got really positive feedback from it. So it was something that anybody can use, that it was open to everybody. We tried to have a workplace seminar and networking event every year to showcase, and Jane spoke at our last, so we're like the double gig. We were together in April in the Department of Health. But that networking event is just, there's huge energy in it and huge enthusiasm and a huge openness for learning and sharing. We got Chambers Ireland. So Chambers Ireland have, I think, their membership is quite high, and they can reach a population, I think, of about 1 million workers. So they did some focus groups for us, consultation with their members around where workplace wellbeing is at, what activities are going on, how much do they know about the national framework and the website. And so we'll be launching that report. It's a snapshot of chambers around the country. So we'll be launching that in the 11th of December. So again, just to give us a picture and some feedback in terms of what's happening out there. We have work going on at the moment around development of resources for SMEs. So that section on our website is not that developed, because like SMEs form the biggest part of our workforce in Ireland, and their needs are quite different to the larger workplaces, and in terms of their resources and their ability to resource can be very different, and as Jane mentioned, the bigger workplaces, they take on someone for health and well-being, or they buy it in or whatever, they have huge resource, but it's the SMEs that we really are going to look at how we can support. We have awards every year with the National Irish Safety Organisation and with the Chartered Institute for Personal Development on looking on workplace wellbeing. And that's been really powerful in terms of growing that message around that workplace wellbeing needs to be embedded in the culture. It needs to be part of the organisation. It needs to be, and you need to be able to demonstrate that it's not just about programs or initiatives, it needs to be wider than that. And programs are really valuable, but our experience in health promotion, regardless of the setting, whether it's a workplace or a school, if they're not embedded, they're not sustainable. And if it's a person, if it's an individual that's passionate about it and driving it, when they leave, nobody else picks it up. So, it needs to be someone's responsibility as well within an organisation. So the awards are good in terms of, so a lot of our case studies come from the awards, and they're all on the website. And so where we're at now, we've spent a year trying to find a home for workplace wellbeing in terms of driving implementation, and some of those we've gone up a cul-de-sac in the last while. So what we've decided to do now is we're going to develop a model like they have in Northern Ireland, where they tender for an external provider to take on that phased approach and recruit a number of organisations, take them through the steps in terms of becoming a healthy workplace, review, evaluate, and learn and build that phase over the next couple of years. So that'll be going out to tender in the new year. We're just working on that at the moment. And then in the meantime, we'll carry on with some of the other areas that we can action ourselves within the capacity that we have in the department. So that's our website. That's what it looks like. It's just www.healthyworkplaces.ie. And we just have, there's the wellbeing areas are in there. There's a resource hub, the case study. So there's news and a calendar. But websites are only as good as they're maintained and updated. So we are lucky at the moment. We have somebody that's supporting us with that work. And as I said, the SME section is very much the section that we need to further develop. So then, in terms of the challenges, I suppose some of the challenges are a common understanding around workplace wellbeing. And I'm sure those of you that have been involved in the psyched area, the whole area of mental wellbeing, mental health wellbeing, there's so much debate, and there's, how people understand and interpret them can be very different. So common understanding, I think, is really important. In the development of the National Mental Health Promotion Plan, we're trying to agree at the moment on what a definition for mental health promotion. I know there are definitions out there, but we're trying to agree it with a number of people, and that in itself is challenging because people can have different perspectives on it. So I think a common understanding as to what workplace well-being is, I think, is really important. Leadership management support where it's not happening, and organizations would ring and say, well, how can we get the managers on board or whatever. So it's like stepping back, making a business case, looking at what information you have, what stats do you already have, what are you collecting already that teach you a lot. So are you collecting absenteeism, are you what sick leave, what have you got already that you can put towards trying to make a business case. And that's why I think as well that kind of having the national policy is hopefully a support for that as well. Embedding it in the workplaces, because as I said earlier, very often people go off and they start with really good intentions and say, we'll do something on physical activity, or we'll do something on healthy eating, just a topic-led initiative. And it very often doesn't get embedded. So it's like that strategic piece is really important. Who is responsible? And I've learned this, since I've been working in this area, it has to be someone's responsibility, has to be on someone's job description for it to have meaning and a value. So that is critical. Resources for workplace wellbeing continue. There is such a need for more resources and supports and toolkits and all of that, and that's something that we are looking at, and we'll continue to develop that through the website in terms of provide as much support as we can for workplaces. And the SMEs, as I mentioned, and I've also mentioned evaluation tools, because we really need to be evaluating this as well. And if nothing, to make the case, because evaluation helps us to make the case. And that's a really important piece, because management can change. We've all had that experience where somebody's been really supportive of something we're all enthusiastic about, and then management would change and decide it's not a priority anymore. So, these are all real challenges. So I suppose just a few reflections from myself. It needs to be an integral part of an organization's business goals and daily operations. So it's not a separate thing out there. And it reminds me of when we came into health promotion years ago, we were the people who did health promotion over there. The rest of the health system was over here. And we've spent all those years trying to get it to become everybody's responsibility. While we might be the specialist role, it's actually everyone's responsibility. But very much health promotion was delivered by a group of people over there. So it's that piece about really bringing it into daily operations and how organizations deliver. They need to take the strategic approach to well-being, and the evidence shows us that it reaps more positive outcomes. And the strategic approach needs to go beyond just programs. So the programs fall under the strategy, and that's based then on the need of the organization. And the training for the managers, as I mentioned. And I really believe that we should be doing much more personal development with managers. Because if I'm managing other people, I need to know myself. I need to be aware of how I am. I need to be aware of how I react, or I need to be aware of how I relate. So, and in fairness, a lot of managers' training don't include it. They're given the toolkit, and this is how you manage, and this is how you communicate. But actually, very often they don't have the personal resources. They're sometimes getting the pressure from the top, and then they're trying to manage underneath. So, but it's to bring this, for this to become the norm. If I have a responsibility of managing people, which is a huge responsibility, I need to be aware of myself. I need to know myself. I need to know how I come across, and I need to be open to feedback, and it's continuous learning. So I think that's a really important piece in terms of workplace well-being for me, because I know in my life, when I had poor management, was the worst time in my well-being. So, it is a critical piece. And just to leave you with, I think for me, this sums it up. fortunate enough a number of years ago to have Carol Black. She came over to Galway with a conference on workplace wellbeing, an amazing lady in the UK who's worked tirelessly at workplace health promotion. And I think she's well in her 80s now, and she's still in the university, plugging away. But she says, to embed health and wellbeing into workplaces, you must start with the leaders and boards and managers, and then provide the fruit and bicycle schemes. And that sums it up for me in terms of what we're talking about. So thank you very much. There's my email address. There's the website link. And